Hi, guys. Dr. Hampton here with Tonika Greenwood. Tonika is a patient of mine and a guest on my Protecting Your Nest podcast, episode 43, where we discuss everything related to metabolic surgery, also known as bariatric surgery. I will definitely have a link to that episode in the show notes to this video. But today, Tonika wanted to ask me a question that may have been on your mind as well. Tonika, ask the question you have.
So, Dr. Hampton, I wanted to know why you and my bariatric surgeon wanted me to lose weight before my surgery. I thought that was the entire point of having bariatric surgery, was it helps you to lose the weight, but you all want me to lose weight before. Why is that?
I know. It's insane, right? And even as a doctor, before I got my bariatric board certification, I asked the same question. And I remember that movie that we've all seen, Honey, I Shrunk the Kids. Well, actually, instead of shrinking the kids, we may want to think about shrinking the liver. So one of the most important reasons to have that surgery is to shrink the liver. The beautiful thing about weight loss is that a lot of times we know we lose water, and particularly with a low carb diet, you lose water because carbohydrates attract water. And when you go low carb, you get rid of water. So that's one of the reasons why you lose water. But you shrink the liver because when you lose fat from your body, it always leaves the organs first because they're vital and they have a important purpose. But why is it important to shrink the liver, right? Well, because the liver is a huge organ. It's large, it's heavy. And if you're a surgeon, you need to move the liver out the way to get to the stomach. So if it's a heavy liver, a large liver, it creates a lot of problems for a surgeon who needs to do that type of surgery. So that's one of the first reasons. My surgical colleagues would also say that if you look at the literature, this type of process with a heavy liver also increases your surgical risk. So it's kind of a technical issue. And when they look at the data, it's also an issue as it relates to your risk for surgery is just higher. There's a rhythm that you have to get into when you have major surgery, bariatric or metabolic surgery. And that rhythm has a lot to do with how you eat, right? So we want to get our patients into the right rhythm, into the right mindset, because they're going to be eating differently. And if they've not done any of these changes prior to having surgery, they're going to struggle. And we don't want them to struggle when they've just had a major surgery. And if you recall, they start, you have this liquid diet, then it's a soft diet. And if we do some of that before we actually have surgery, we do much better. We'll talk a little bit about that in the podcast. So for those who want to learn more about that, absolutely check out that episode. And finally, studies also show that weight loss, maybe 2 to 4 weeks before surgery, really decreases the chances that patients will have any surgical complications. So it's actually a great way to be a little safer from a surgical perspective as well. And so I'd say anybody that's considering surgery, be mindful that you're not going to be able to skip that diet change part of the equation. When you have surgery, you still got to change your diet either way. So I really appreciate this question. Tonika, what was your experience like when you had to adjust your diet? Was it hard? What was it like for you?
So it wasn't too hard because of the simple fact, as we all know, Dr. Hampton is my primary care doctor, and he's been pushing keto for years. So it wasn't that hard because I was already in the eating habit. So I was able to lose like 15 pounds before surgery. So I was used to the liquid and fasting and doing the intermittent fasting with the keto. So it wasn't hard at all for me.
I like that. I always tell people, in fact, anybody who's considering keto or intermittent fasting, maybe do keto first, and you'll find that intermittent fasting will be much easier. So I hope that this question that some people may have had, which is why I got to lose weight, which is crazy before surgery. I hope this answer helps to clarify some of that. And I really appreciate you, Tonika, for asking the question, of course, being a guest on the podcast. So for all those checking out this video, if you want to continue to learn insights from my great guests and myself, like and subscribe to my channel so you won't miss any of my videos. Thanks for watching this video. And as I always say, be safe, be well, and continue to protect your nest. Take care, Tonika.